Joining us to discuss more about this is the Director General, Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpeyong. A pleasure having you with us.
Thank you very much.
And what's the immediate need of the agency, especially towards restoring the damaged facilities across those 4 local government areas?
So thank you very much. Unfortunately, the incidents that transpired affected all the sectors virtually, and of course the health sector wasn't spared, and the Cross River State Primary Healthcare Agency, so our facilities in 4 local governments were also hit. One of our walk-in cold room that serves in storing our vaccines was grossly vandalized, and of course a lot of our cold chain equipment in Bakassi, Akpabio, Calabar South, and Calabar Municipal were also affected. So this is actually hampered on our services. And of course, we are hoping that we can restore that immediately. And I must commend also the state government because it's been very responsive and trying to see how we can get a permanent standard cold chain office, of course, to store our vaccines as we prepare for the upcoming meningitis campaign.
But what is the short-term impact of the damaged facilities on vaccine storage in the state?
Yeah, this had actually impacted grossly on the state, and because some of our vaccines, especially those areas that were actually hit, they've had to rely on the nearby LGAs, and right now we have to improvise by storing our vaccines in the cold boxes, and we've also had to move some of those vaccines to other nearby LGAs. So in terms of transportation, in terms of availability of those vaccines in all those LGAs, there's a whole lot of gap there, and we are hoping that we'll be able to bridge that gap very soon. We need more solar panel refrigerators. We need more, our health facilities that have been destroyed need to be fixed immediately so that at least we can improve our services in those affected areas.
Now, before I let you go, Dr. Ekpeyong, in terms of immunization programs, where are we now? And you mentioned some things that need to be done to ensure that the state can manage vaccines. But what about managing an outbreak of diseases, especially with the yellow fever, which is in some states in the country?
Okay, so for immunization, Cross River State right now we are at 85%. We are hoping that we can hit the 100% mark. Although this had actually set us back because one of our walk-in cold room that has been serving us was really affected. But we are not relenting, and that's why I must commend His Excellency because currently, like I said, we are building a standard cold chain office, and we are in terms of our response to outbreak, we are also hoping that we can get the necessary support because our our reference lab was really affected because of the vandalization that also occurred. And if we must have an effective public health response, that is part of the support that we should be having from the federal government and from other partners. So what we currently have disease surveillance and notification officers all across our local government who are, and also have community informants in case of any outbreak. We are ready to respond. At least we also have a tertiary facility that we can still fall back to while we await the response from the federal government for us to have to build a new reference laboratory.
A pleasure sharing your thoughts with us on the program, Dr. Janet Ekpeyong.
Thank you very much.